Hi everyone. Today I'm going to be talking about communication impaired. I'm sure many of you have heard of communication impairments before, and I hope to teach you some new information today about them. Alright, so let's get started. So on my first slide I have the very formal definition of the disability. In simpler terms, communication impairments are any problems children have with speech, language, voice, fluency, or social communication. The most common in kids are problems understanding and using spoken language to exchange ideas, speech disorders, stuttering, and voice problems. A communication disorder may range in severity from very mild to very profound. It may be developmental or acquired, and it may result in either a primary disability or it may be secondary to other disabilities. Today I'll be talking to you about 4 major communication disorders. The first one is speech, which is an impairment of the articulation of speech sounds, fluency, and or voice. Articulation disorder is if a child is continuing to make errors like saying wabbit instead of rabbit past the expected age. Fluency disorder is when students or children are having problems with repetitions of sounds, syllables, words, and phrases, and stuttering is the most common fluency disorder. And then finally, voice disorder involves either abnormal pitch, loudness, or quality of the sound produced. Okay, the next disorder is language disorder, which is impaired comprehension and or use of spoken, written, and or other symbol systems. It may involve either the form, the content, or the function of language in communication. The form of language includes phonology, morphology, and syntax. Content of language deals with semantics. And then finally, function of language includes pragmatics. The third major disorder is hearing, which is the result of impaired auditory sensitivity of the physiological auditory system. It may limit development, comprehension, production, and or maintenance of speech and or language. Individuals with hearing impairment may be described as deaf or hard of hearing. Okay, and then last but not least is central auditory processing disorder, also known as CAPD. This is a hearing problem that affects about 5% of school-aged children. Unfortunately, children with this condition cannot process what they hear in the same way other kids do because their ears and their brain do not fully coordinate. Something interferes with the way the brain recognizes and interprets sounds, especially speech. With CAPD, early diagnosis and the right therapy are both critical. All right, so for the causes of communication impairments, there are quite a few potential causes, including autism spectrum disorder, which Molly talked to us about earlier in the semester. Unfortunately, we do not know what causes many communication impairments. However, some communication problems might have genetic links. For eligibility and classification, this process is of course very important. All parts of an evaluation must be considered when determining eligibility. The parts include test scores, informal measures, and the functional assessment. The functional assessment should be written up based on observations and teacher reports of what they see the children doing in the classroom and how they're doing, and or parent and teacher questionnaires or interviews. A child can be classified as communication impaired or can receive language therapy as a related service under another category of classification if he or she is diagnosed with a language disorder, and that disorder affects educational performance, and the child is determined to be in need of special education and related services. Like many things with communication impaired, prevention and early intervention are the best treatment. It's very important that parents and guardians are paying attention and are aware of their children and when their children are reaching important developmental milestones. Of course, some children do things very early, and other children take longer and do things on the later side. But overall, parents and or guardians should be making sure that their children are hitting certain milestones around the expected normal time and age. If parents and or guardians are concerned that their child does have speech language or hearing issues, and they should definitely talk to the family doctor sooner rather than later. That is very important, because then if a child does have issues and the parent and or guardian does not recognize them, then the child will most likely have difficulties and problems later on in life. There are many professionals out there that will provide help and support and treatment, including a general practitioner, a speech language pathologist, an audiologist, a developmental psychologist, special education teachers, a family and child health nurse, and or a genetic counselor. So there are many accommodations for children with communication disorders. Students with communication and language disabilities may need one-to-one presentations and the use of a computer with a voice synthesizer. And students who are deaf and hard of hearing may need either note takers and or front row seating. So as future counselors, we definitely need to be aware and knowledgeable and understand what students who are classified as communication impaired need and want and what they struggle with. It's also very important for all teachers and all school staff to be aware and knowledgeable and understand what students need, so we can all help these students reach their full potential at school. It's very important for school counselors to work closely with special education teachers and with speech language experts in order to help these students. Things we can do as future counselors are allow students who are communication impaired the time that they require to express themselves. We should not be interrupting them. We should be patient with them. We should also just speak to them naturally, keep good eye contact, and be good active listeners. Also, as future counselors, we just need to make sure that students are receiving everything that they need and that they require. So like I said, that they can reach their full potential and succeed at school. For the deaf and hard of hearing students, teachers should check privately with the student to determine whether he or she feels comfortable speaking in class. And teachers should also give students adequate time to respond to questions to allow students who are or with a hearing impairment to participate in class. Finally, for language disorders, we must be aware of the student's functioning level in different areas and how they affect academic performance. And then for speech disorders, we must be good speech models. We must model not only correct speech patterns, but we should avoid correcting speech difficulties. And overall, at the end of the day, our job as school counselors is to be that support system and that positive role model for all students. And then specifically with students who are communication impaired, we must understand them and know about them and just simply have awareness and knowledge. And we definitely, of course, want them to feel supported and cared for at school, and we need to continually do that throughout the entire school year. And we definitely need to advocate for them and show them that just because they are classified doesn't mean that they can't succeed in school and reach their full potential. Thank you for listening to me today, and I hope you learned some new information about communication impaired. If you have any more questions, please let me know. Thank you.